Well, we have seen the images. This was what it looked like of raining ash. We're seeing toxic air quality due to historic wildfires, and experts are warning that outside and even inside air could pose serious health risks. Joining us now is an expert, our emergency room physician, Dr. Michael Daigneault, our Fox 11 medical contributor. Dr. D, good to see you.
Good evening.
Okay, so a lot of people, we knew last week, right when this was happening, smoke was everywhere, the air quality was terrible, you're coughing if you go outside. A lot of people were staying inside.
Right.
Now we're at a point where hopefully we don't have a lot more fires. A lot of the smoke has dissipated. You look at the air quality sensors, it looks like it's all green.
Right.
You say deceiving.
Yeah, I think it's falsely reassuring because, as you mentioned, the air quality index, using things like IQ Air, if you look at the map today, it's all green. But you have to remember that that only tests for 5 common pollutants. So that's ozone that's close to the ground, particulate matter like wildfire smoke, and then carbon monoxide, sulfur dioxide, and nitrogen dioxide. But it doesn't test for all those carcinogens like lead paint, asbestos, plastics, things that could have been in these buildings pre-code that are now in the air. And there's just no way to test for that. We just have to assume that that stuff is in our environment right now.
Yeah, because a lot of those buildings in the Palisades were built at a time before the asbestos rules went in, and probably some of them in Altadena as well.
True.
When are we safe? How do we know?
I think the unfortunate answer is we don't. We just have to give it a matter of time, and you just have to assume that even if that air quality index map is green, that you're going to be exposed to those particulates. And I think you have to be very careful. You have to wear the N95 when you go outside, and that's for the broader LA County area. Even if you don't smell smoke, you have to assume, you have to protect yourself, because as we said before, we don't want to realize in 10, 20 years that we had a 9/11 type event where people were exposed to all these carcinogens after.
Well, talk about that. So that was especially a lot of the first responders that went and worked on the pile in 9/11, and then years later, a lot of them got cancer.
Right. And, you know, you think about the scale of the World Trade Center, and then you talk about the amount of buildings that were burned with particularly the 2 fires we had here. It makes me really nervous, especially for the first responders, but then for the greater community too. So
you're talking about not even, maybe one thing if you like live in Pacific Palisades, but you're talking about all around.
Right, yeah. I mean, if you don't,
because we don't see that. We don't see most people wearing masks right now.
Right, and I think that's the scary part. People think that if they're far from it, if they don't smell smoke, that they're potentially safe, and I don't think that's the case, especially if you have cardiovascular disease, lung disease, asthma, you're very young, you're elderly, you're going to be more exposed to having difficulty.
What are you seeing in the ER? Are you seeing people come in with this problem?
Well, right now I work mostly in the South Bay, and so, you know, we haven't had a lot of particular, and it's kind of hard for patients to say, you know, the wildfires set off my asthma, my respiratory disease, my cardiac disease. Certainly there's flu and other things like that right now that are more likely to cause those asthma exacerbations. But I think going forward, you know, I wouldn't be surprised if we see more of it.
So bottom line is, if you can work out inside, if you can do stuff inside, try to stay inside, at least for now.
Yeah, I have a lot of friends that are runners, and they've been asking me if they can go back to their runners club, if they can train outside, and, you know, I'm telling them to still stay in the gym or try to go further south. The farther south you can go to run outside would probably be better. People at home have to make sure that their windows, their vents, their doors are sealed well. Try to limit indoor pollution, so the candles running, smoking, things like that inside. You don't want to do that. You need an air purifier, you need a HEPA filter, and those are just some things you need to do. And I don't think we're out of the woods as far as the air quality, and we won't be for a while.
Yeah, and I wonder if we got some of the things we talked about.
Yeah.
Wearing the N95, keep indoor air clean, limit use of candles, gas, smoking, use HEPA filters, air purifiers, all good advice from Dr. Daigneault. And hopefully someday soon we can get a drizzle and try to clear out some of the air.
That would be wonderful.
Some nice wind and a drizzle, not hard rain, because then we're going to deal with mudslides, and that's a whole other issue. Dr. D, great to see you. Glad you're safe.
Thank you.